Coming to histopathology of dentigerous cyst. Origin of dentigerous cyst is by the separation of residual enamel epithelium from crown of tooth. Then there is fluid accumulation between crown of the tooth and residual enamel epithelium. So, histopathological features of dentigerous cyst resemble residual enamel epithelium. Now, coming to histopathology of residual enamel epithelium. The residual enamel epithelium is composed of 2 to 3 cell layers, and it is supported by loosely arranged connective tissue. We have to remember that residual enamel epithelium is also called as primitive epithelium. Second important component of dentigerous cyst derived from dental follicle. Component forms connective tissue. The connective tissue is composed of fibrous connective tissue, fibromyxoid connective tissue, loosely arranged collagen fibers. In addition to these two features, connective tissue also contains inactive odontogenic epithelial rests, mucous cells, and ciliated cells. Picture shows lumen, then this lumen is lined by epithelium composed of loosely arranged cuboidal cells. We are seeing here that there is no keratinization and there are no ratty ridges between epithelium and connective tissue. The connective tissue is composed of fibrous cells, fibromyxoid. It is composed of odontogenic rest. In addition to these features, also there are mucous cells and ciliated cells seen in connective tissue. So to summarize, the epithelium has no superficial keratinization, there are no ratty ridges, and cuboidal epithelium loosely arranged. Whereas connective tissue, fibrous, contains collagen fibers, epithelial rests, mucous cells, and very rarely ciliated cells. Occasionally, we come across inflamed dentigerous cyst. Inflamed dentigerous cyst differs from uninflamed dentigerous cyst we have already discussed. Inflamed dentigerous cyst has certain additional histopathological features. Number one, there are ratty ridges, more prominent. Connective tissue contains chronic inflammatory cells, cholesterol clefts, or Paxton bodies. Also, scattered mucus or ciliated cells are seen. Connective picture shows lumen lined by epithelium, and connective tissue is fibrous and is composed of fibroblasts and certain inflammatory cells. So the criteria of the cyst is satisfied, that is, its prominent lumen is composed of thin watery fluid, epithelium lines this lumen, and connective tissue forms support of the cyst, and it is also called as connective tissue capsule. Conclude why it is a dentigerous cyst. Number one, epithelium is characteristic. It is composed of primitive epithelium, that is, it is composed of residual enamel. It is formed by residual enamel epithelium. Odontogenic islands are seen. The epithelium is 2 to 3 cell layer thick, and connective tissue not characteristic, but there is presence of odontogenic arrests. Mucous cells helps it in differentiating from other cysts. Lastly, some questions. Number one, why it is a odontogenic cyst? Number two, why it is called as follicular cyst? Why it is called as dentigerous cyst? And what are the characteristic radiographic pathology features? Let us try to answer all these questions after studying dentigerous cyst. Thank you.